how does NPI work? What would you answer?
It's just a way of reconnecting pathways that are broken, removing obstructions in the body.
Welcome back to Straight to Health. My name is Dr. Gavin Hall with Straight Up Chiropractic. I live here in St. George, Utah, where this is a podcast where we want you to learn something new about healing, about your body, and the potentials that your friends and families might find interesting to heal their bodies. Today, I have Dr. Eric Rawlin on with me. So welcome, Doc.
Thank you. It's great to be here. I appreciate that, Dr. Hall.
I'm excited to have you on today. I've had a couple of previous episodes where I've wanted to bring in who I would consider to be my mentors and who have taught me what and why I became the person the doc that I am today. And I think you've greatly influenced that. So I'm glad that you accepted my invitation to join me on here. Today, we're mostly talking about the role that you had in developing NPI, or neural pathway integration. In a previous episode, we talked kind of about muscle inhibition, how to reverse muscle inhibition. But before we get on that question, though, I actually wanted to ask you, could you share your background, what kind of education you might have, and what brought you into where you are today?
Yeah, of course. Well, it's been a long time. I went to did my undergraduate at Utah State University in Logan, Utah, and then went on to Parker College of Chiropractic in Dallas, Texas. And so that's where I graduated there, got my license to practice chiropractic in January of 2003, and decided I'd open up my own practice, and been doing that ever since.
Okay. All right. And that's been then, you said 2003.
Yeah.
So you're looking at 22 years?
Yes.
Is that the math right? That maths. And so I know that you've been doing chiropractic for that long. Have you been doing muscle inhibition as well since then, or what kind of grew you through to the NPI point?
Yeah. Kind of how that came about was, really the background was I started out as traditional chiropractic, and then 2005 is when I got introduced to basically turning on the muscles through Dr. Bueller, and trained with him and went forward with that until 2017 is when I first started realizing that there's more, where things started to click. And so in the system, I knew there was more things that we could do with the body. I always felt that there was more. There wasn't anything out there. I was always intrigued by learning. And so I'd take different seminars, and just somebody say, hey, you got to go see this thing. I'd go pay for that just because I just wanted the knowledge. Just because I guess I was searching. I was just searching. There had to be something. But I just never really found exactly what I was looking for. Things were good, but I knew it could be better. And then 2017 is when I figured out how to actually identify and how to treat structures in the body. So then we went from muscles into ligaments. We learned how to turn around ligaments and greatly speed up the healing process for ligament tears and injuries versus the current paradigm. And then that kind of led into like, well, if you can do ligaments and you can do muscles, what else is possible? So then we went into organs, and it was like, hey, that worked too. And then it was 2020. It was just before, 2020 is when it kind of hit, where we realized, well, wait a minute, even deeper than all of those structures is the brain pathways. Like, that's what controls everything. And so then we stumbled on identifying that we can influence that too. And so that's where neural pathway really started is, in fact, the first thing I still remember, the very first thing I ever figured out how to do was what we call the vermis.
Okay.
And, as you know, Dr. Hall, I mean, it's really simple to treat, but as soon as you treat it, the person will stand up straight, their shoulders are back. It feels like somebody's pulling their shoulders back, but there isn't. Like, it's posture, because that's what that specific part of the brain signals the body have upright posture. So when you stimulate that part of the brain, it's just immediately the function's there. And they stand up straight, shoulders back. So we'd have some people come into the office, and I knew you had a lot of times where that happened too. They're kind of bent over, right? Lay them down, you treat that, they stand up, and they're just walking out tall.
Yeah.
It was pretty incredible. So that's what really kind of blew our minds. We're like, oh, this is amazing. What else can we do? And just kind of snowballed from there.
Sure. So for those who maybe haven't listened to my previous episodes, the idea is this idea of muscle inhibition is kind of where he started. Inhibition being that a part of the body is overwhelmed because of trauma. We have different, what would you say a couple of things are that will shut down or inhibit an organ or a gland, or kind of what you talked about?
I think it's a lot of factors, right? I mean, obviously trauma can be there too, especially when you talk about neural pathways. Concussions are huge, especially when people say, oh, it's not that bad of one. You just have a headache afterwards. Well, it's still trauma, physical trauma to the body. It can be emotional for sure. You can have emotional abuse. You can have mental toxins, just the garbage that's in the air, what we eat.
I was going to say the food.
Yeah. I mean, right. It's going to have an effect for sure. And so I think just over time, that's just what causes our bodies to break down.
Okay. I've had a couple of people ask me, they'll say, well, emotionally speaking, do I just have a bad day? And typically I'll try and respond something to the effect of, well, people have panic attacks, right? It's typically the overwhelming something that will trigger it to become inhibited or to shut down and misfire or misfunction. Would you agree with that idea?
Oh, for sure. Yeah. It's when the body, it's just logic, right? If the body gets overloaded, then something's got to happen. Something's got to give. And so then the body is always designed, which is, I think, kind of amazing, is that our bodies are so incredible that you can have a problem, but your body is going to adapt and compensate for that in a way that it tells you everything's fine. And it's not until somebody else points something out, right? To you, like, how come you walk with your right foot flared out? And they're like, what are you talking about? I don't do that. Until you look down and you're like, I guess I do. Or you're like, I don't walk like that, or I don't do that. And then somebody videos it, right? And then shows you, and they're just shocked because they're like, really? We've had multiple people with a lot of times it's like teenagers, teenagers will react a certain way. Mm-hmm. Like, why are you always mad? And they're like, I'm not mad. As they're glaring at you, and you video them and you show it to them, and they're seriously shocked. But that's the incredible nature of what our bodies can do and what they're capable of. They're just flat out are going to continue to do whatever it needs to do to allow you to keep doing what you want to do. So
you don't have to be in pain to know that there's a neurologic problem.
Oh, for sure, right? Pain is definitely, honestly, what I tell patients when they come in is, they're like, well, my pain's here. Well, pain's never the problem. When you tell them that, and sometimes you get kind of a weird look like,
that's why I'm here.
Are you nuts? Yeah. What's wrong with you? But because it's whatever's causing the pain, that's the problem. So a painful knee, it's not the pain in the knee. The pain is the alarm going off. The body's trying to tell you, I got a problem. So that's where the fun part is. And I know you've had a blast, doing what you're doing and building the practice that you're building, for the fact that it's just like each case is so unique. You can have 5 people come in with all have knee pain, and you're going to treat them totally different for each one because it's coming from some other aspect of the body.
Yeah, I found, can you talk about a little bit chronic compensation? Because in a previous episode, we talked about the muscle inhibition and how, you have an acute injury and it works really well to reset muscles. But the more chronic that becomes, the more adaptation you have to the joint above, below, and up the chain, if you will, down the chain. How does that jump into, or how does that affect the neurologic component of things?
Well, I mean, ultimately, right, everything's going to come from the signals from the nerves, from the brain, right? The brain's got to tell it what to do. So anything physical is still going to have a neurological tie-in. Okay. What we've also found is even, it really kind of seems like a lot of the physical is almost compensatory for something deeper for a lot of people. And so, and I think that just goes by, if you look at the paradigm or what we've done forever, right, is like, oh, here's the problem. We're going to treat this. We're going to treat this. And then what we're taught as a school, right, is like, here's the things you can work on. Here's the things, if you see that, immediate referral, right?
Sure.
Don't even touch them. And so it's almost kind of like you get categorized into like, that's your role. This is who you are. Don't go outside the lines.
Sure.
But if you think about, I mean, honestly, the way it makes sense in my head is like, look at every breakthrough that's been out there. Is it somebody who everybody else thought was nuts, right? And they were just started thinking outside the box and said, well, why are we living in the dark? You know, you go back to Thomas Edison, all the stuff that he came up with. And it's just like, that's how it's been. But yet people thought the guy was weird.
Sure.
Right. And it's just, but that's the creative nature. If we're willing to tap in, but it didn't fit the parameters. It didn't fit where he should have been, where you're supposed to stay. But we all, I believe, have that innate ability inside our bodies to create. And when you tap into that, the joy and the satisfaction that you can have out of life is incredible. Mm-hmm. And then one of the coolest part is, even if somebody's had issues through injuries, through traumas, through just the way they were brought up, and to believing that they're not good enough, they're not, they don't measure up, right? And so you just, well, this is my life. I'm just going to deal with it. The coolest part is you don't have to, because not necessarily take it that way, but honestly, who created us? God creates us, right? Well, it was in His image. So you got to realize He's a creator. What does that mean? We are. And when you tap into that, there's a sense of joy. I mean, just seeing the smile on your face right now, because you get it. I mean, Dr. Hall, because when you're in that room and you could just feel that, you're just like, this is incredible. Like, I want other people to feel this. And the greatest thing is I'll tell even patients this. I'll say, you don't have to believe a word I tell you for this to work. Right. Because a lot of times there's a lot of things that say, well, if you're not going to believe, it's probably not going to work. This totally doesn't matter. We can have people come in and they're like, yeah, whatever. This is weird. You treat them and their problem's gone. And it's that fast. That's how fast the body can respond if you remove what's causing the problem, the obstruction. You hit
the heart of the injury, yeah.
Absolutely.
Yeah, it's funny. I have a couple of experiences where you get this grumpy guy come in. You'll go, oh, my wife wants me to be here because she thinks that you can help. And then you treat something and he'll realize there's a difference. And the look on his face, it's usually a man, because men are stubborn and they don't want to believe that they can be better. Maybe that's a thing. But that look on their face is almost priceless. Every time I see it, I'm like, this will get better. You don't have to believe anything, kind of what you were mentioning. And they'll go, well, good, because I don't think it's going to help anyway. And they pop off the table and they're like, what did you just do to me? So absolutely, I can certainly relate in that regard. But I wanted to highlight really quickly, you said something about a neurologic or organ or other problem can have muscular presentation. Tell me more about that one, because I've had a couple of patients who will say, well, I don't remember hurting my knee, but I have knee pain. How does that work?
Yeah, I think, kind of go with emotions for example. I mean, the theory would be like this. You can have somebody who saw something that was severely traumatic, which leads into PTSD. Mm-hmm. Now, that for that person, sometimes it is something that happened to you, but there are people that have it and the event never actually happened to them. They weren't physically in the car accident. They weren't physically, harmed by it, but it was such an emotional event that it created a physical problem to them. And then it can cause organ failure and other issues too. So there's a lot of that too. And so, the way that, we tend to go by that now is then you're going to go in, you do some therapy, you work with a counselor, you're going to do meds, you're going to do, the whole gamut of everything like that to try to get you to be able to better handle it in order to function properly. Mm-hmm. But really, if you go back to it, it becomes kind of, think of it as chaos going on with the wiring in your brain. Right? Because it's just all these electrical circuits, right? And so that event was so dramatic that your body, it created almost like a trauma inside that basically makes your body change the way it's thinking about things. And then it goes into protective mode. So now you're like, well, I don't want to get in a car because of that car accident that I saw, and the person, passed away or they were severely injured. And so now they're scared to get in a car. Well, they weren't even in the car in the first place, but that's real. It is real for some people that way. But that created a new memory, and your body's always wants to protect yourself. Right. That's obviously just getting outside that a little bit. That's what a lot of the restrictions are. Where people are like, oh, I can't, rotate my arm, externally rotate it. I'm restricted. I'm real tight. I guess I'm just, need to stretch more. I'm out of shape. That's not what it is. Your body's restricting it because it feels vulnerable. Mm-hmm. Right. And so it always wants to be solid and strong. So one of the, I think, phenomenal things that we've been able to do. And I've done that multiple times. In fact, the one that pops in my head, the last time we saw, which was a unique one, I had never really seen that before, but it's a person who has issues only when it's cold outside. It was really interesting. They get a certain pain anytime they have that, and then it's hard for them to breathe. And so everything's looked at pathologically. There's nothing wrong with the individual.
It's all in their head, they're told.
Right. Whenever it gets cold, they just flat out have shortness of breath, and they just have pain. And so for that individual, as I started talking with them, we brought it out. What it was I kind of was thinking at first maybe she got locked outside as a kid and or left outside in the cold or something like that. Sure. But honestly, what it was is mind blank here, but basically when they go outside, she went outside and she remembered the one day she was looking so forward to playing on her playground. That's what it was. So she goes out in the backyard to play, and she was so sad because she couldn't play because it had snowed. So she couldn't go down her slide.
Interesting.
So that happened when she was a kid. And ever since then, it just triggered that when it gets cold, she just shortness of breath. She's sad. It's just depressed, everything like that. And it doesn't matter if she does medications or anything. Nothing's ever changed it. Mm-hmm. And so what we did is we worked on her with the neural pathway integration. It ended up being, as you very well know, part of the parabrachial nuclei is what we did with her for that specific event. As soon as we were done, I asked her about the event. And she had no emotion attached to it. She goes, I remember doing that, but I don't feel sad anymore. And so I said, all right, you're going to have to wait till it gets cold again and go outside and see how you feel. And she went outside. She hasn't had a single problem since. So it was just that one single treatment took care of it. But that is seriously the amazing part about the body and what we're bringing forward, the work that you're doing here in St. George and elsewhere. It's incredible how fast and how much you can really help people. I really think it's a lot of this too. We know what we know, right?
Sure.
And so a lot of people think, I'm feeling good. I don't need to go in. I feel fine. I don't have a problem. I can do everything I want to do.
There's no pain.
Right. So you think that's as good as you could be, but you don't realize you could be like 8 levels above that. But if you're cool just living right there, that's awesome. But you don't realize what you could be feeling and what you could be experiencing. And that's what this work does.
Well, you kind of mentioned the other day when we were talking, the dimmer switch idea. Could you talk about that one?
Oh, yeah. So after treatment, most of the time, because what we're doing is we're turning on neural pathways in the brain. So you feel it, but we're not used to feeling that very often. Honestly, the closest thing I can equate it to, if somebody has ever, not that it's the most healthy thing out there, right? But if you just down an energy drink, right? You just down that, you get all that caffeine pumping through your body, and you feel a little kind of buzz feeling, like a little activity going in your head. Your eyes are like bulging out now, right? And you're like, it's good for mental focus, right? And so that's what you feel, right? But usually we don't really feel that type of thing. So after you treat something neural, very, very common, they'll stand up and they're like, whoa, I feel a little lightheaded. And then you can ask them, you say, well, like you're going to pass out, feel dizzy? No, it's not that. And so that's when I'll explain them the dimmer switch. I said, it's like a dimmer switch. You can take that and basically that's what we're doing with your brain is we're turning that light up. And so you're feeling stuff connecting and firing that wasn't firing before. And they're like, yeah, that makes sense. And a lot of times they'll come up and they're like, oh, I've never seen that. Have you always had that picture here? You're like, yeah, it's always been there, even though you've been seeing us for a couple months, right? It's like you're just aware of stuff because, honestly, it's like this. Hopefully you've never done this. I don't recommend it, right?
I will not confirm it whatever brings
there
up.
You go. That's awesome. You've been driving and you're like a little tired. I'm going to get there, so I'm not going to pull over. I'm going to make it, right? Okay. If you've been in that spot, how good are your senses? Like,
not ideal.
Where are you? Everything around you. You're not, right? And that's how a lot of people are going through life right now is they're just like, they got the blinders on. They don't see the other stuff that's out there. They're not experiencing what they could experience. And when you turn that stuff on, that's been kind of like not working really good, right? You bring that dimmer switch up and it's like, oh my gosh, like I can see so many more things, right? And so it's just really cool to kind of see those changes
Yeah, yeah, and I've heard a lot of that. That feeling of that dimmer switch very active is a lot of concussion stuff. That brain fog, the confusion when they're talking. I don't know how to. You lost your thought in the middle of a sentence. That type of a deal. That trigger or that reset, they're like, I don't really may not notice it, but then their wife, their spouse, their someone else also is a big proponent of, no, you don't do that nearly as much as you used to.
Yeah.
But
yeah,
so
absolutely.
that's super cool. If someone were to ask you, how does NPI work? What would you answer?
Interesting question. Basically it's just a way of reconnecting pathways that are broken, removing obstructions in the body. So when we go about it, when we're doing a consult on an individual to find out what's going on, what are your labs, what kind of images have you had, it's more so about like not necessarily, oh, I have a shoulder pain. It's like, but why do you have a shoulder pain? Is there something that led to it, right? Mm-hmm. Because there's always, you got to take it back to the root cause. And if you can go after that, then that's awesome. You can knock it out of the park. And so how it works is really you're kind of refiring those connections. It's like a wire, you have a loose wire. It's not like it's not there at all unless you've had surgery and it's been removed, but it's like a loose wire. So you have that flickering light going on. And so, I got to tighten the light bulb up. Or it's like, oh, I guess I got to change it out. But if it's the wire that's just not connecting correctly, it doesn't matter how many light bulbs you change. It doesn't matter about the rest of the stuff. It's still going to have a problem until you go and you fix the actual wire. And so what this is these are all mapped out, right? I mean, it's the anatomy. When we go in and we start working on a new area of the brain, I mean, that's what we do. We go out there and look at what research is out there for, the parabrachial nucleus, what research out there is for the cerebellum, the dentate nucleus, all these things that are like, nobody even heard of unless you've taken some neurology class, right? Mm-hmm. But what we've been able to do is break it down to the different specific functions of it. Most of that research has been done because the medical research out there is incredible. They do such an amazing job of getting the information together. The problem is honestly where we're lacking is what do you do with it?
Sure. Because you've done this brain scan, you've done all these tests. Right. You know that the parabrachial nucleus is a problem, but we're just going to have to wait and hope that, sleep up, take a good a good diet and hope for the best. That's kind of how it goes, right?
Right. I mean, that's pretty much the best care out there,
yeah.
Right? And what we're saying that we can do is that we can find out, especially if you've already told us exactly what's wrong. Well, that's simple. We'll just say, hey, lay down. Let's fix this.
Sure.
Perfect example. I had this a patient that I was working on. He's got neuropathy at his feet. It was a super easy thing. He can't feel his feet, right? But he's had all the images. He doesn't have an issue with his nerve. He doesn't have a tumor, cyst, cancer. I mean, there's no pathology
diabetes
there at all, right? He just can't feel his feet. And so at that point, they don't know what to do. So they'll give you, some painkillers. They actually were giving him painkillers. I'm like, well, he's not really in pain, just can't feel it. But, that's what he was told. So he's taking that. And then you can take some different nerve, was it Neurontin or one of those? Anyway, so you take
like
these different meds. Gabapentin's given a lot too, right?
Yeah.
But they're given that, but it doesn't change anything because that's not what the problem is. So it'll never change it. But now you're dealing with all the side effect stuff because he was having a lot of digestive issues too that were going along with that, constipation,
sure.
Which is really common. And so he told me what he had, and I asked him the background, with no issues, and I'm like, okay, lay down. I got this. And so we just treated the specific thing that he had. What it was is a very specific part of the brain called the primary sensory cortex, which it was for him. So we reset that one, the part that goes specifically down to his feet. And as soon as I cleared it, I said, now stand up and you're going to feel the floor. And he stood up and he felt the floor. Actually, that was about probably 2 months ago. Mm-hmm. I spoke with him on the phone yesterday, actually. And he's like,
doing well.
He's like, still like, I can't believe I can feel my feet. Yeah. He goes, this is crazy. But again, if you just fix what the real issue is, you don't have the problem. But I think, as you know as well too, the best thing about what we do, there's no risk. There's nothing that we do that's ever going to create a problem. Well, how many things out there can say that there's no risk to it? And then coupled with the results that we get and how fast we get it, I don't think there's anything out there that can compete with what we're doing.
I would agree, because typically if someone comes into my office, well, you agree or disagree, I'd like to know your thoughts on it. But when someone comes in, they'll say, what is it going to look like? Am I going to get worse? Typically I'll say, no, either nothing's going to happen or you're going to get better.
Yeah.
in my opinion, I've had two people who came back and said, you made me worse. But one of the persons I found out got in a bicycle accident like 2 days after they saw me, and they were like, you made it worse. Anyhow, I was confused with a couple of these. But for those individuals who may not respond, how do you answer?
Well, I actually say it very similar to what you say, is especially, I do a lot of phone conversations from people that
Consultations.
Exactly. Cause they don't live locally. So it's kind of like, okay, well, let's see if it's even the right fit.
Sure.
We never want to waste.
Don't want you flying
time.
in from Florida.
100%. Right. And so, but as we go, I'll tell them, you're going to be one of two things. Either you're going to feel a difference or you're not, and we're not going to waste your time. If we're not getting results, we're not going to waste your time and have you come in.
Yeah.
But reality is, then at that point, what do you have to lose then?
Well, what increases their chances of having good results versus not?
I think it would depend on identifying exactly like where is it coming from for them. And sometimes, here great example would be, people that come in and say, I want to be treated for my anxiety or depression or something like that, right? Well, it'd be really easy if there's one center of the brain that controls all that, but there's not. There's multiple areas that could come from. So how I go about those cases is I'll let them know in the first part. We'll just kind of show them on our software, right? That correlates everything together. And basically you can say, okay, look, here's all the centers, here's all the pieces that tie into emotion. We just need to figure out what it is for you.
Which portions of all these will greatly or your body wants treated most.
Right.
Is that accurate?
Right. So then you just go through it. And so I tell them, look, we're going to try a couple different things and see what the result is. So you treat it, you go, okay, how'd that go? I don't really feel much difference. All right. Well, then let's not continue down that line. Let's try this road because there's multiple roads to a destination, right? Sure. So then you try this. I don't know. You try this. Oh, that feels different. Well, you just found what it is for them. So now okay, then it ties to this. But now that once you know that, then you can direct their care very specifically. And so very quickly, you can get the results that they need. So sometimes it might take a visit or two to do that. But if you really look at the alternative, I mean, it's not like, it's going to take, 24 visits before you're ever going to notice a difference. Sure. And then you're going to be here, once a month for the rest of your life. I mean, the idea is our concept is we shouldn't have to repeat anything that we do.
Agreed.
We're going to find, as soon as we find out what it is, we can go after it. And that's why you can get the results so quick because we've identified what it is.
Mm-hmm. No, I agree. In previous podcast episode as well, when we talked about muscle inhibition, I kind of talked about, well, if we know that the muscle will be reset, assuming that there's no greater injury present. If you've torn your meniscus and we're working on a knee thing, then I can reset the muscle, but it's going to become overwhelmed again because there's still a greater injury present. So I kind of, in my head, I think of it being very similarly with neurologic concern, that if we reset something for concussion, but then you go and play football again, well, you're having micro concussions almost every game. And so I can't guarantee primary or fantastic results all the time with those.
Yeah, for sure.
So those are just a couple of ideas that I had to add to your thoughts as well. But you mentioned the whole 24 visit thing. How does this style of care compare to maybe other, both chiros and other physicians in general?
Yeah. I think, wow. Yeah. There's a lot of thoughts going through on that one. How does it compare with other things out there?
You can start with, do you do adjustments still as a chiro? Do you do exercises? What does that compare? What does that look like?
Yeah. Honestly, really, it's a case by case. And so, and that's why it's really important when we do our history and our consultations, identify, I want all the data. if they've got labs, I want to see it. If they've got imaging, I want to see it. What have they already tried to do? Because if they've already tried, they come in and say, well, I've been to the chiropractor, I've been to the physical therapist, I've done the injections. Well, I already know right there, if I'm adjusting them, it's not going to make a difference because they've already tried that. That didn't work. It's not going to work if I do it because that's not their problem, right? If they've already done therapy, well, that means that it's not an issue that should help them get stronger. But that didn't change it either, which means probably there's something inhibited, not even firing. But neurologically, it's like you can almost always find those connections, those tie-ins through possibly like some of the motor pathways, things like that. But I think one of the to me personally, what I think sets everything that we do apart is not just the amazing part about getting the body to function correctly again, which is great because then you get some ridiculous healing and reversal of stuff that you're going to be told that that's impossible and you can't do it. Well, I don't think anything's impossible for the body. I think it might not happen, but to say nope, can't happen, that's kind of maybe not the best way to look at things. Anything's possible. If we're not getting the results, we're never going to waste somebody's time, right?
Sure.
But yeah.
Yeah. An additional thought that I have when you mention that is I have conversations with a couple of physicians. They say, no, we know a lot about the body and we don't think we'll find any more. And I think, well, the more I learn about the body, the less I feel I know, because you dive into even one of the areas of the brain where we've been talking previously, like parabrachial nucleus. Like, okay, what is associated with parabrachial nucleus? And then next year there could be another research article that comes out and says parabrachial nucleus is actually related to this and this too. Research shows. And so we're like, okay, research is very limited in my opinion, but it's so vast, but also so limited. But anyhow, I wanted to move on. What kind of conditions, we've talked about a few already, what kind of conditions do you see most often treated with NPI or helped?
We do a lot of digestive stuff.
Okay. And you're talking like pain when eating, like dietary restrictions.
Sure. I mean, you could deal with, it can be a reaction, right? Like you get inflammatory response to the mast cells and through the organs. IBS, you can have that. You can have constipation, diarrhea, indigestion, all those things. Well, they're all basically inflammatory processes. And so the question is, why is that creating that inflammation into there? And so what we do is we can go through the specific parts of the organ. One of the other things that we've been doing to help the body start to heal and change things would be, somebody comes in like, okay, well, especially if they're type 2. Diabetic or whatnot. Well, there's going to be some digestive issues there too. And, if it's not pathology, it's not a tumor, it's not, things like that going on, they're just not producing insulin. And that's why they need they're insulin dependent and have to add the insulin in. Well, that means the beta cells in the pancreas aren't functioning because the beta cells produce the insulin, right? So then we go after that, we can stimulate the beta cells to start to function again. And then what happens, and we've got the lab results on patients. We've done the before, the after, through the whole process, and we've collected that data. So we have the proof of it. And every time they go in, the one case in particular, she didn't want to tell her medical doctor, what she was doing. But every time on her lab work, he's like, you're too high of insulin. We're going to have to adjust you again. We're going to have to start taking less, until it was through a 6-month process. And in her last one, she gives me the report back. She says, I'm off everything. My doctor said, you don't need anything anymore. We're going to take you off of everything. And so we've been able to do that with those types of conditions through Graves' disease, which is again considered, well, you can't change it. Well, the body can, and you get what the body needs active, and it works. And I think one of the biggest things on thyroid that gets missed is, you got a thyroid issue, Graves' disease, Hashimoto's, whatever. They're looking at the thyroid, but you got to look at the loop. The thyroid is going to communicate with pituitary. Pituitary is going to communicate with hypothalamus. If you're not going to look at the whole loop, well, then you're going to miss stuff. Yeah. And so that's why I think we've had such great success, because we can get all those things functional again. That means the body communicates, it talks in a risk-free manner, and then the body just starts to change. And it's not us saying it, because they can go get the labs, and the labs are flat out changing.
Sure. Yeah, it's been super fun. I had an adrenal fatigue case that came in, and the guy was like, can you do anything with my adrenals? I'm like, let's find out, bring it on. Let's do something with this. Right. And he didn't as well share that he was going to see a chiropractor for adrenal stuff. And about 3 months later, he calls me, he says, the medical physician I've been going to see doesn't believe, he's never lowered medications for adrenal fatigue. He's only had to say, well, your adrenals are getting more tired. Let's crank up the medication. We got to supplement even more. And so he was just blown away. But super fun. How many physicians, or how popular is this? How many physicians are currently trained in NPI?
Honestly, this is infancy.
Okay.
In the aspect that we've kept pretty much everything in our main office in Utah. And as you know, you worked at the office for a while before branching off on your own, which is awesome. Super excited about your success. And we have another one, but we're currently taking it to another level. So I personally, as of January, I retired from patient care.
Oh, really?
So I don't actually see patients on a daily basis anymore.
I didn't know that.
Yeah.
Okay.
Yeah. Why I did that was for a couple different reasons. Main one is really it's time to get it out. I've always tried to be the person. I don't want to ruffle anything. I don't want to have conflict. I don't want to cause problems. So I'm just cool, just doing my thing. But when you hear story after story of what people are told to do for things, and you're like, "Are you kidding me? Like, really?" I was on the phone and I shared this with the individual last night. He's just got introduced to him. He's an orthopedic surgeon out in DC, and we were on the phone talking about some different things. And I told him about a case that we had where the patient goes in, he went to an orthopedic, and then he didn't like that answer, so he went to another one. Both of them told him the same thing. They said, "Well, we need to cut both your biceps tendons. And if we cut those, then your pain will be gone in your shoulder." He goes, "Well, then I won't have them anymore." "Yeah, but your body will still be able to flex through the other muscles, and then you'll be out of pain." But he's like, "Well, that doesn't sound right." Yeah. And so, again, it's like, it's things like that people get told. And well, my doctor said it, so it must be true.
Sure.
Well, what we did is we ended up doing a couple of things. We were able to, in the state of Utah, the awesome things, we got some legislation passed to where stem cells are available and you can use those. And so that's what we did. We used stem cells to help regenerate the tissue using umbilical placental stem cells. And we did that through IV and through injection. And then we treated him neurologically to reconnect the wires to make it functional. Well, the guy has no problem. We treated him twice. That's all we had to do. We treated him twice. He's swimming. He's back doing everything he wants, has absolutely no pain. And he still has his biceps tendons intact. I mean,
sure.
Again, it's just like all these things that we're being told. And I don't believe that they're, other professions are saying that, because they're just trying to, get money or whatever. Sure. I'm not one of those guys that are saying that.
Yeah, the intent should be accurate, right?
Yeah.
But, hey, this is based on my knowledge. This is the best thing that I've got for you.
Yeah, and that's how I feel. However, there's another way. There's another option, and I believe everybody needs that. That's why, honestly, a lot of what Robert Kennedy, what he's platforming on, right, is he's not against anything. He just wants choice. He just wants everybody to have the facts. And then, you know what? You, as an American, have the right to choose what you feel is best for you and your family.
Sure.
That's how it should be, right? And this is no different than this. We just want people to know, look, there's an option.
Yeah.
And if it feels right to you, awesome. If it doesn't, that's okay. But at least you know, whereas things are set now, you come talk about any of the stuff that we're talking about right now. And it's like, you're a little bit worried you're going to get a knock on the door and you're going to get arrested because
Sure.
they're going to tell you you're practicing medicine without a license. Well, we're not practicing medicine because we're not prescribing anything.
Yeah.
Does that make sense? But it doesn't matter. That's what they're going to accuse you of.
Sure.
So it's really, that's one of the big things. I said, it's time to get it out and let's give everybody the options of what's going on. So we're building a platform. I've got some amazing individuals that have stepped up and they approached me. This happened really fast. It was just a matter of like 2 weeks where they said, look, we love what you do. We believe what you can do. We have the resources to be able to take this around the world, but you got to commit. If you can't commit to making this happen, then we're not going forward. And so I made that commitment and walked away from my everyday practice to do that.
Okay.
And so a lot of the cases that I do now are a lot of research ones that we're doing currently. Again, this would get me in trouble before, but at this point, I don't really care because I'm not doing anything that's outside of my scope of practice. We have an individual who very shortly, everybody's going to start hearing about it. He's a very well-known individual who's had MS for almost 40 years. And he's just gone downhill as anybody that has that goes downhill. And there's no way to change that.
Yeah.
Now, I would never make the statement that, we're going to cure anything. That's not what it is. But what we can do is we can help the body start to heal and change.
Sure.
So this individual, he's starting to have function with his bladder again. He's standing up now. He's doing things that his doctor said absolutely are impossible and that he'll never do again. And he's doing them.
Wow.
So that tells you the power of the body. And again, he and his wife are just ecstatic for the fact that there's a change, right?
Sure.
And again, people need that. Now, how much nicer would it have been to find that person 30 years ago?
Sure.
That would have been great because we could have probably even done more things, although we weren't doing this work back then. But now I mean, if you've ever suffered, my father-in-law, he passed away with ALS, and we took him everywhere he could. And everybody really tried. I mean, they really did everything they could think of, and it just nothing changed it. And so, that's been one of my things where it's like there's got to be a way that the body can heal things like that, because we've seen too many other things. And so that's one of the things I'd love to be able to help find a way to help somebody dealing with conditions like that.
And so you're assuming that you're continuing to develop more work for conditions that we don't have treatment for yet. Is that accurate?
Absolutely.
Okay, because that was one of the great things that I liked about the idea of NPI is, we've developed quite a few treatment ideas for stomach problems, for digestion issues. And then you're like, well, we need some more for kidney problems. And then we need some more for, so it's continuously developing approach of my knowledge.
Yes, absolutely. And I think two of the conditions out there that are devastating as well, that are actually we're seeing tremendous results with and fairly quickly are going to be dealing with Alzheimer's and dementia. Anybody that's had a family member that has that, you understand how frustrating it is for the individual going through it and the family members.
Yeah.
But basically what those have in common is the degradation, breakdown of the white matter in the brain. And so we've just recently, a couple months ago, were introduced with some technology called iMika MRI. So it's a brain MRI, but it's a company out of Canada that does it, and they call them an ANDI, an Andy. Basically, they'll go through and they will track out and recreate all 33 of the white matter tracks in your brain and tell you exactly through that information how well are they working, what's going on. And if those are breaking down, well, then now we go after those specific areas of the brain and it comes back again. Like these are people that are getting their memory back. These are people that are changing in a way that, as of right now, what we're taught is not possible.
Sure. And there's objective data to support that via this MRI. Right.
And then we go get the follow-up and you can flat out see it. One of the things that really kind of led me to that, Dr. Hall, was I had a patient come in with a brain MRI.
Okay.
Right. And I went back and looked it up after I found this information, but it flat out said this. It says, has mild to moderate chronic white matter degradation.
Okay.
So basically, they just told that their white matter is breaking down, which means they're going to have some problems, right? Yeah. And then so I remember talking to the patient and about like, okay, well, what did the doctors tell you? And I told them, I said, they probably told you, look, we're going to monitor it and see what happens with it. And she's like, well, that's exactly what they said. Well, I said, how about we just go after and start to reconnect and see what happens?
What happens.
Exactly, right? I mean, it's that.
If we're going to wait, we might as well let your body heal while it's waiting.
Right.
That's awesome. That's fantastic. Well, I don't want to keep you too much longer. I appreciate those who might have stuck with us this whole time. If someone was interested in learning NPI, how do you see it progressing for physicians? Do you have any requirements for an NP versus a DC versus an MD versus a DO? What kind of ideas have you had for the physicians going forward?
Yeah, of course. I think, there's difference as to how you want to practice, what you should always do, what makes you happy. What's your joy? What's your passion? If you got to be away from your family and you've got to be in an office, why not do something you love? That way you love doing it. So when you go home to your family, then you're like, I'm still in a good mood, versus if you hate your job, you hate what you're doing. I mean, your family's going to take the brunt of that. And that's just not a great way to live, because you don't have to. So what we're looking for is what we're actually doing with what we're going to be rolling out here in the next couple months is we want to set it out into modules, meaning that, let's just say like if you're a physical therapist, right?
Yeah.
Well, you're going to be more involved and you want to say, okay, how can I use the brain pathways to get muscles to work better, to get things to be more connected so that I can have better balance, so I can have, get rid of the vertigo or the instability that I have, or why do I keep blowing my knee out? Things like that. Yeah. They're not going to be so interested in like, oh, here, I want to fix your gut issue, or here, let me help you with this or that. That's not their concern. And so we want to tailor it specifically for them. Same thing with like, we feel there'll be some dentists that'll be interested in doing TM&J stuff, through the trigeminal nerve.
I didn't even think about
We've
that.
We've had huge results with Bell's palsy. I'm sure you've seen cases like that. Yeah. I mean, how easy is that to take care of?
And well, Bell's palsy is interesting because they of my understanding still, they're like, well, we don't know what brings it on. You'll get an antibacterial or an antiviral, and they'll say, well, we'll hope for the best. And there are people who will do a full course of that medication and still have no improvement. And so if it's accurate that the virus is actually the problem, then it should be helped. And so I find it very interesting that when we start to mess with it, I've had only one of Bell's palsy specifically, but I've had a couple of the trigeminal neuralgia where they go, well, this is so strange. I don't know how it got better after a couple of pressure points and some treatment, So
Yeah. No, it is incredible, truly, what the body can have. I have one that just popped up just because I'm still blown away with it. I remember when she came in, I didn't think it would change at all. Basically what had happened is she was taking a medication, and one of the side effects of the medication is suicidal tendencies. So she took this medication, she went home, put a gun in her mouth and fired it. It went through, shattered her jaw, and exited back out. So it did not take her life. But prior to that, she never had any of those thoughts. So she was referred into the office to say, is there something we can do? And I'm like, I don't know about that. Sure. But I tried something. And I'll tell you, that's why another reason why I believe anything's possible is I treated her for probably 20 minutes. When she got off the table, 100% of her pain was gone. She felt nothing. I've treated her one time since. And I think that first time I treated was probably about 6 months ago.
Okay.
She has never had pain, that one blows me away.
Yeah.
I didn't think we'd see a change with that. She did have a reconstruction in her jaw. That's when I saw her the second time. We just treated a couple things to make sure things were firing into there, and she's like just gone. I don't believe that that's going to be every case, but right there, those are those miracle cases where you're like, you know what? This is incredible. And everybody out there deserves the opportunity at least to hear about it.
I agree. I had actually just someone on my previous episode, they came and they shared their story about a cheerleader. If you haven't listened to that one, I'd recommend it because that was also, when you mentioned previously that regardless of the patient's mindset, they will still see results. I also reverse that. And I think even on the physician, if I don't think it will happen, it doesn't have to be with my mindset. You push on you do the right treatment and you can get the right results. Because there was the same person or a similar person who came in and I was like, I don't know if I can help you, but let's, like we talked about, if there's nothing that we're going to make worse, so either
for sure
nothing happens or you get better. And this particular individual, great story, she was in a wheelchair, and after the second visit, she stood up and pushed her mom out because her mom was like, are you seriously standing right now? And she pushed her mom out of my clinic in the second visit. Oh, wow. It was the coolest thing. I was like, that was unexpected, but we must have hit the nail on the head for the right treatment that your body needed. You know what I mean? So it was incredible. But those is just some of those things that I'm like, I'm glad that I don't have to believe in it, because if it were based on what I believed, then I'd go, well, let's hope for the best. I don't think we're going to get anywhere with it, but So super cool. Well, thank you very much for your time. Is there something or a method of communications that an individual or a practitioner who is interested in learning might be able to reach out via email or anything similar, a website or anything like that?
Well, we probably the best thing is just, you can contact the office. Braden runs the office. And then we'll be putting out some new content as we get out and start doing seminars here in the next couple months. We'll be starting those. Mm-hmm. We think probably March, April is when we should be having those up and running, where people can come in and the idea is to set them up so that you can also do it virtually, so you don't always have to fly to Utah. Okay. The first one we'd really like to see in person, just so we can really help you understand exactly the basics of what's going on, how to use it, answer your questions, show you really truly how it's extensive but simple.
Yeah.
It's not the hardest thing out there, the most complicated thing out there to learn. The greatest thing too is, as you know, it's not like you got to go out there and buy a whole bunch of expensive equipment. You're not going to invest
your hands in a computer
in equipment.
Yeah.
Exactly. Pretty much everything you need, you already have right now in front of you.
Yep.
Which is, again, just how amazing is that?
Yeah.
Lowers your overhead.
It's incredible.
And the results that you can get are like immediate, right?
Yeah.
So we'll be hitting all that out. But we have...
so for now, then they would call your office.
Or
just
call the main office.
And what's that phone number?
That's 801-774-0266. Mm-hmm. We're just out of Layton, Utah. And then...
and your clinic name is?
Performance and Healing Chiropractic.
Okay. And the website for that one?
UtahHealing.com.
All right. That's a pop quizzy for you.
Yeah. Wow. Okay.
That's fantastic. Thank you again for being here with me, Doc. It's been you're a great mentor of mine. You've taught me so much, and I appreciate everything that I've learned. The ability that I have to help people because of what you have started. And it's just the snowball is rolling, and it's going to be tough to stop, in my opinion.
And we've got great things coming. Thank you, Dr. Hall. I appreciate you.
You're very welcome. Thanks for the listeners. We'll see you next time.